So this is somebody who has seen your videos before. It says, in his video, Dr. Scholz states that an MRI can replace a random biopsy. I recently had an MRI and a grade 4 spot was indicated. In addition to the targeted biopsy, my doctor wants to do a 12-core random needle biopsy. I can see the need for the targeted biopsy, but I don't see a need for the 12-core procedure at this junction. So what recommendation do you have?
It depends on the quality and the skill of the doctors. How well performed was the MRI? How good is the doctor at hitting targets? Many times as people are getting started up, they don't trust their skills to be able to hit the target, and to cover for that, then they want to go back and do a random biopsy in addition to the targeted biopsy. So maybe that would be appropriate if the doctor is just in his early learning curve and he's not totally confident that he can hit the spot, the lesion that was picked out on the MRI. This whole idea of moving away from random biopsies is based on your having access to great MRIs, great doctors to read the MRIs, and skillful doctors to do the biopsies. If any of those fall apart, then the risk, of course, is that someone goes in and does a targeted biopsy thinking they hit the spot. Biopsy comes back clear, there's no cancer, but in actuality, through someone's lack of skill, they missed the spot, and the cancer's still there. So the whole idea of relying on MRIs and targeted biopsies as a substitute for random biopsies is based on the trust in the quality of the system that you're using. I have enough experience in this area to know that I'm dealing with very skillful physicians in each of those realms, and for that reason, I'm very comfortable advising the patients that I see to forego a random biopsy, that it's superfluous and in some ways dangerous. I mean, we know there's about a 2% risk from random biopsies of being hospitalized with life-threatening infection, that it can cause erectile dysfunction. I don't ascribe to this idea of spreading cancer that some people talk about. I don't think that is a risk, but the other risks are serious enough. And the third thing, of course, is that they end up finding more 3+3 when you do random biopsies. There's a lot of unwinding to reassure people that this type of cancer isn't a cancer. Well, why do they call it a cancer? So that's another risk of the 12-core random biopsy. So people should have a 12-core random biopsy if they cannot get the skillful top-level experts to do their MRIs and do their targeted biopsies. Otherwise, if they can, in my opinion, you can safely avoid a random biopsy.
And for those of you who are looking for quality MRI centers, the PCRI website, pcri.org, also has all these centers listed based off of your state. So in this case, it would make sense, it sounds like, if the guy didn't get a 3T MRI or didn't have a quality, maybe he does get a repeat MRI and then finds a doctor who has a practice in targeted biopsies. Would that make sense?
Yeah, well, I mean, the process of finding quality in prostate cancer is like anything else. Finding a good electrician, finding a good plumber, a good babysitter. I mean, it's not an easy process, but it's an essential process.
Hey everyone, it's me, Alex, and our mascot, Hunter. You can check out his Instagram, Sir Hunter the Dow, at the link below. Don't forget to subscribe to our YouTube channel, and in fact, if this dog high-fives me, high five, can you high-five me? Thank you. You have to subscribe. Go subscribe to the YouTube channel. He even thinks that's awesome. Also, don't forget to visit our website, pcri.org.